that PHRs have, I think, the opportunity to be sort of a game changer when it comes to IT and thus healthcare more widely. We don't want PHRs for PHR's sake. What we really want are PHRs to be sort of the narrow end of the wedge in terms of digitizing health information more broadly. Like I said, this is not, we're not expecting that the use of PHRs would be transformative of healthcare in and of itself. We're not asking that much of doctors to really change the way they're doing business to get the incentives in this bill. But our hope is that if we can get patients, consumers, looking for PHRs as a part of their doctor-patient relationship, if we can create that expectation that technology is going to be able to enhance their access to medicine, to health care, that they won't necessarily need to go to the doctor's office every time they have a sniffle because they've got a doc who they can work with online. Maybe you can hook it up with automatic medication dispensing in the home. Maybe you can hook it up with video conferencing and do a video conference with your doc. Maybe you can do other kinds of remote monitoring so that the chronic disease patients, you can check the blood pressure, you can check the glucose levels or what have you. There's ways that PHRs can be the backbone of trying to bring healthcare out of the doctor's office, to make it less episodic and more continuous, to make it more of the kind of care that we intuitively know we want, and that is going to be more efficient in the kind of care that is recommended by any expert panel that looks at this, in terms of prevention, primary care, and the like. So the goal is to get PHRs open that door, and they establish an expectation that IT is going to be a part of this relationship, and then we can build on that. And if there's, we can sit here in Washington, create all the incentive programs we want, and do our money for this and our Medicare for that. At the end of the day, no government program is going to be as successful in driving the use of information technology by providers as consumer demand among patients, saying that this is what we want and expect.